Hello. Hello, everyone, and welcome to this presentation on our paper Collaboration, Not Confrontation, Understanding General Practitioners' Attitudes Towards Natural Language and Text Automation in Clinical Practice. I'm David Fraile Navarro, and I will be presenting the work that we have done together, myself, Baki Kocaballi, Mark Dras, and Shlomo Berkovsky. So we will be covering these different agenda items today: the motivations, the aims, the design of the study, and results, and what will be the next steps for us. So this is the study. It was recently published on Transactions on Computer-Human Interaction, and is available for free access for everyone to read it. So what the motivations are for our study, first of all, is that general practitioners, and myself one, are the main curators of the patient's health record. And that means that they have to deal with many clinical documentation tasks, and these tasks involve a huge amount of text. And this is usually a motive of frustration and burnout for clinicians, especially when they are time constrained and having to spend many times on the electronic health record system imputing or processing text. So the thing is that NLP opens the possibility to automate many of these tasks, and as our previous work has highlighted, there is a need and a willingness from clinicians to use technology, as for instance in the case of a digital scribe. So we aim to understand how text automation can be used in the practice, how it's perceived by clinicians, and explore the needs, their attitudes, and the features that the system might have. So what we did, we interviewed 10 Australian GPs. This was done with semi-structured interviews. First, we gave a snapshot of the current capabilities of NLP and AI, with the most recent advances to date. We asked about their views on AI, first on general AI and then on text automation or NLP technologies. And we provide them with scenarios in case that they couldn't come up with some ideas. We put some examples such as prescribing new drug or receiving a letter from a colleague. With all that, we ask them in the end to think of the consultation of the future. So basically to imagine this technology in place and thinking of new ways of interacting with their AHR system. So we analyze these interviews with a bottom-up thematic analysis using NVivo. And these are the results. First of all, the main theme that emerged was the idea of collaboration, of a reciprocal relation between technology and clinicians. They don't see it as confronting or feel threatened by it, as it would be no substituting clinicians, but more like establishing a dialogue between the technology and themselves. These four themes emerge: doctor-AI collaboration, and to allow this, they require a series of features that they would like to see in practice. Also related to these features, the systems need to address several concerns and challenges. And resolving all this would allow to create the consultation of the future and go beyond what currently is possible. With a bit more detail, Dr. AI collaboration, there are several sub-themes: the progressive automation, the keeping control of the record from the side of clinicians, and also explainable and transparent AI, and having all these features would allow them to trust AI. They decide a number of features to be implemented, and this relates to several NLP tasks, such as information and relation extraction, summarization, the digital scribe, which would combine summarization with speech-to-text conversion and voice recognition. And they would also like to have searchable records and having the possibility to create lay summaries for patients would be a welcome feature as well. They have, although, several concerns and challenges. There's medical legal issues, privacy and safety issues as well that could arise. They mentioned the possibility of automation bias with the use of these technologies, and the challenges of filtering and aggregating diverse and huge amount of information, such as in the clinical record. They also see several implementation challenges, such as the current HR vendors, and there is as well the potential for resistance to change from the side of clinicians. As the consultation of the future, what they would like to see is to move beyond the screen and keyboard. They see AI as a digital assistant and also potentially as an expert system. And the next step for us, we are finishing a prototype testing, which will allow us to explore different modes of interaction with different levels of control and see how safe and how useful it is for clinicians. And this could, in the end, inform future prototypes and some real piloting in the clinical setting. Thank you very much, and hope you enjoyed this presentation.